My name is Ahmed El Idrisi, senior officer based in FAO headquarters in Rome. I'm in charge of transboundary animal disease and the programming, dealing with global program for major animal diseases. But also I'm the strategic advisor of one of the 5 strategic programs in FAO, which is the resilience program, dealing with resilience of livelihoods and communities to disease threats in general. This event that we are organizing today is organized on the side of the 2nd International One Health Conference organized by OHCEA. And this is a part of a series of consultations that FAO is organizing in collaboration with regional partners and global partners to raise awareness about One Health and also to stimulate the debate about this concept and particularly how to make it work on the ground level. So how to turn the concept of One Health into action at country level.
You're all welcome to the Food and Agriculture Organization of the United Nations side event. My task this morning is to introduce to you Bona Diop, a veterinarian at the regional, and he's the regional manager of the Emergency Center for Transboundary Animal Diseases, Eastern Africa, FAO.
Yesterday, FAO colleagues and we have a discussion, and we're asking ourselves, really, do we need to have this session today after the 3 wonderful days that the discussion we have with OHCEA and the side event organized yesterday by PN? Because I think a lot has been done. We discussed a lot. But we say still there is maybe opportunity also to have this session to again explore way to improve the One Health and to put it on more, to better improve the understanding, etc. So it is why we are here, and we are very happy OHCEA is organizing this second One Health International Conference.
So now it's my pleasure to call upon Edward to make a remark on behalf of the FAO representative in Uganda.
Distinguished participants from the donor organizations, distinguished participants from governments, fellow delegates to this symposium, on behalf of the Director General of Food and Agriculture Organization, and also on behalf of the FAO representative in Uganda, and on my own behalf, it is my great pleasure to welcome you to this gathering of today.
This FAO side event is funded by the government of Ireland, which is supporting a global project with the main goal to support FAO effort in advancing the One Health agenda at global level, regional level, and also at country level. The specific objectives of this project first is to develop capacities for disease early warning and disease monitoring, using an integration of data on animals, food safety, and also on the environment.
On specific disease, has also been mentioned during the conference that on rabies, we develop with other partners this stepwise approach to assist countries to develop a strategy and to go along the process for controlling, eradicating the disease. Kenya is one of the examples. On Rift Valley, we jointly with OHCEA, we organize different meetings and to support work that need to be done on preparedness, but also conducting simulation exercise, but most important for early warning. And you know the situation currently in Eastern Africa, it is of real concern about El Nino and the risk for RVF occurrence.
The second objective is to develop and implement what we call community-based One Health approach or initiatives to deal with some diseases that have major implication for people's livelihood, for food security, and for sustainable development. The third objective is mainly at global level, it's to promote the One Health agenda and to promote the partnership with various actors that are also involved in promoting One Health agenda.
We are promoting One Health at a global level in collaboration with our two main partners, OHCEA and WHO. We are organizing but also participating in international fora to promote the One Health. But also what we are doing is to collect information and data, because you know FAO is not on animal health. We are not providing the standard because this will all belong to OHCEA. But we are developing tools, guidelines that can help countries to build develop their strategy, develop their policy, etc. So, but this is based mainly on collaboration with partners, having information, using reference laboratory center that we are collaborating. This is really using a really a network that we have worldwide to get information and relevant information.
This project has been very, very active in implementing activities in some countries in East Africa, particularly in Uganda, where we are working with the veterinary services in Uganda to approach some specific diseases at the community level, at the village level, by developing some locally adapted approaches that can be put forward by the local communities. And that's what is really important. And while doing this, we are also trying to promote this interdisciplinary and multi-sectoral approach, which is the One Health. Countries, they have identified priority diseases. And many countries in East Africa, they have prioritized some diseases that are considered a bit neglected, like brucellosis, which is a zoonotic disease transmitted from animals to humans, like anthrax, which is also a zoonotic disease, which is transmitted from animals to humans, and rabies, which is also a very important disease that is also affecting both animals and humans. So if we take, for example, anthrax or brucellosis, this disease cannot be controlled if we don't involve the communities, if we don't involve the people at the community level, because there are many approaches based on vaccination, for example, based on developing surveillance strategy. But public awareness is very important in dealing with those diseases. So we have a series of locally adapted approaches based on community awareness, because that's important to deal with the disease from different aspects, from the human side, from the animal side, and in some specific disease also from the environmental side. Anthrax people, they get it. Why? They get it because sometimes they lack the knowledge about the hazard from that disease. So when an animal is affected by that disease, anthrax, they rush to slaughter it and then to eat the meat out of it, because most of these people are poor and they want to save these animals so that they can make better use it before it dies. And this is a practice that contributes to the spread of the disease and also the transmission of the disease to people. So that's what this project what is doing. It's to better understand the local knowledge at the community level, and based on that knowledge, develop locally adapted approach to deal with the disease. One Health approach has proven its added value in many countries, and FAO is working in many countries worldwide, not only in East Africa, but also in Asia, in Central Asia, in other parts of Africa. And indeed, the One Health has proven its added value when you are dealing with emerging diseases at the animal-human interface or animal-human ecosystem interface, like the avian influenza. We have very good success stories from Vietnam, where FAO was working with the government to develop further this One Health or One Health inspired approach. We have also good examples from Egypt. We have good examples from other countries in Africa. So there are some success stories, but we still need to promote that approach to deal with some diseases that are considered neglected. I think the disease now, the One Health approach is being developed mainly to deal with emerging diseases like avian influenza, and FAO is also pushing to practice One Health to deal with neglected zoonoses, like the one that I mentioned before, particularly in Uganda, where the government or the veterinary services of the government, in collaboration with the local communities, they have prioritized the disease that are important for the local communities, and working with FAO to develop those approaches to deal with the diseases from different aspects. Data management on the information system, information on the disease, developing the preventive and the strategies, surveillance strategies, and also mitigation and control strategies. And I think that's one of the major output of this project. Other outputs are at the regional or global level. At global level, we are developing a series of guidelines and tools to advance the One Health agenda. One of those guidelines or one of those products is our report that was published in 2013, which is called the Changing Disease Landscape. We have distributed some copies here in this side event, which is a very important report because it focuses on disease drivers, on how we can tackle the emergence of disease before it happens, and that's important. So how we can apply some upstream approach, and those disease drivers, they can be many: globalization, trade, climate change, land use change, and many other aspects. But also the report is dealing with disease burdens that are caused by those neglected diseases that have major implication on food security and people's livelihood. FAO is working with the line ministries at all levels, at central level, policy level, but also at regional, at country level, and even at local level. Civil society, the private sector, the academia, through partnerships, through agreement to help develop and implement the FAO work on the ground. So I think FAO, yes, the line ministry is the main interlocutor for FAO. And whatever FAO is doing in a country, it has to be in agreement with the government and also in line with the strategic plan of the. But in the same time, there is room for developing some collaborative work with other sector, including the private sector and also universities and civil society in general. I think it was a very successful international conference in terms of, first, the number of participants. I think I heard about 350 or 400. That's something. Second, the active participation of the participant in the conference session, but also in the side event, including the FAO side event, and also the quality of the discussion and the presentations. There were some very, very good presentations, very inspiring discussions, and I think this was reflected also in the FAO side event today, where I think there was about 100 participants. This is, to me, is a real success, and the level of participation also, the active participation and the dialogue. So all these are indicators for a successful international conference and also the side event that goes with it.